All right, so now these are just a bunch of the different psychiatric diagnoses. We're not going to go over these, but this is going to be the only diagnosis slide that I'm going to have on here for you guys, because now we're going to talk about symptoms, okay? And I want to talk about not this stuff. The reason that there are psychiatric diagnoses, okay, is so that psychiatrists can talk to other psychiatrists, psychologists can talk to psychologists, so that we can actually have something that we know that we can bill for, okay? A lot of these diagnoses I don't like, okay? I don't like. Some of them are way overused. Some of them I just think are not good diagnoses to use in kids. It's bad. So when the family comes in, I make sure that I tell my residents, they come in, they say, okay, here's the diagnosis, I think. And before they do that, I say, no, back up. What are we treating? What are the symptoms? Sometimes they'll be like, well, we're treating the schizophrenia. And no, back up. What do we need to do? What does the family want? What would be their number one thing they would like to have improved? I didn't ask that. All right, we'll go back and ask it, and then come back and we'll see. So they'll do that because you got to think about, we need to treat the symptoms. Because, I mean, if you look and you say, am I going to treat a developmental disorder? Am I going to treat schizophrenia? Am I going to treat an eating disorder? Yeah, we can treat it, but we're not going to fix it. Sometimes when you see the diagnosis, people think, well, we're going to make that better. So what we need to do is you need to think about it as symptoms. Okay, we need diagnoses so that we can all bill. Okay, they're a necessary evil. They do help us all talk to each other. But remember, diagnoses are what we talk with, not meds. So if you guys ever see something that you see a kid that you're like, oh, this kid's on Depakote, he must have bipolar. I got a lot of kids with seizure disorders or actually chronic migraines that I put on Depakote. Okay, so you don't ever assume a diagnosis based on the meds. And actually, I've had that sometimes with a couple schools where they'll be like, this kid's got to be bipolar because he's on Risperdal or he's schizophrenic. And I'm like, well, no, he's just got aggression. And so don't ever base it on the meds because we don't always have those indications, even though we use it for something. The whole issue with research and everything else. So when you see a lot of these are so that we can all talk to each other, okay? And what I hate is that even though I will tell families what the diagnosis is, I'll say, here's the diagnosis for your kid, but here's the symptoms we're going to work on treating. I think parents need to know symptoms. We all need these, okay? But with that, we're going to go away from that. So we're going to talk about these different behaviors. And I have slides on all of them except like the anxiety and I think psychosis, but we'll go in developmental disorders, but we'll go through some of the other ones. And what I'm going to be showing with all these things is we go through them one by one. We're going to talk about what are some of the causes of it, and also what are some of the treatments and what are we going to do, okay? So causes of anger, it could be anything. I mean, how many of y'all have gotten angry? Right, everybody. Okay? And y'all don't even raise your hands because you're like, that must be rhetorical because we've all gotten angry, okay? So when kids get frustrated, they feel helpless or they feel frustrated, but they don't know how to express it in words. And they can't go out and do the exercise, rearranging their rooms. They can't do these things. Well, they can rearrange, but usually it's tearing things down. They don't have that level of thinking and that complexity to be able to do some of this stuff. So when you see a kid getting angry, you really want to be like, okay, what's bothering you? And they may say, Mom said no. But sometimes it's like, it could be that simple, but other times you say, well, wait, is there something else going on? Okay? They only get angry when they come home from school. Maybe they get teased on the bus. You got to figure out the pattern and look at the time frame and get them to even help draw it out sometimes. Anger can be triggered by illness, embarrassment, loneliness, isolation, anxiety, and hurt. Counterdependencies of fear and loss. So now let's go to this. So what do you do with it? Okay, and this is what's important, is that if you're at a point where you had just gotten some bad news, that's not the time to talk to the kids about this stuff. Okay, what you've got to do is you've got to find a way to, if you're angry, if that's the reason your kid's angry because you're angry also with them or something, you be under control first, because if you have anger talking to anger, all they hear is anger. Nothing is communicated at all. So the biggest things with family communication, what I will do is I have parents, I said, if somebody, I don't care who's the first working person to call it and say, I can't deal with this, you walk away, you set the timer for 15 minutes, okay, and not a watch, because a watch is attached to a person, and the kid will look at a watch as being attached to the parent, and that means the parent is enforcing this time. You get egg timers. Egg timers are great. Let the kid decorate it if they want. Okay, and they can have their egg timer. You set it for 15 minutes, and when 15 minutes is up, you have to, even if you're calm at that point, you don't walk away. You come sit back at the table, and you start discussing it again. If the anger's come up again, 15 more minutes, you come back. And it sounds like, oh, it's a lot of stuff. But you keep doing that, and after even like a week or two, it's going to be a lot better, and they'll be able to sit and calm, take deep breaths, and learn how to control that anger, and it works very well. So control your own anger first. Reward good behavior, okay? If they did a good job handling it when they're angry, like that they were able to walk away, cool down, and come back, you're like, great job, that's awesome. Doesn't mean reward, give them money or whatever. I mean, that just give them praise. Remember, they want attention, Good versus bad. Give them the good attention. Don't give the bad. Don't accidentally reward the bad behavior, okay? And so they, break something and then they decide, oh, I'm sorry about that and I'll help you pick it up. Well, don't reward that they just broke something. Okay, so you got to be careful to not accidentally, even though they're helping you clean it up, there's still something bad that they had done. Punish some bad behavior. And when I say punish in there, that is very dependent on the family. And so this is where what we all do, working with these kids in these families, we have to figure out what is appropriate within that family. Okay? Sometimes it may not agree with what we think. Okay? Whether you think of spanking versus not spanking, whether you agree with it or not, find out the family and what they feel is appropriate and what's not. And if their spanking is something that you're kind of like, that's abusive, well, then that's things that we need to address. But sometimes they may say, oh, I just tell them not to do it anymore. And you say, well, that's it. What about timeouts? Or what about, so, you got to figure out whatever that punishment is, but it needs to be appropriate for the event. Counseling and therapy, and then med management if needed. Okay, it's okay to be mad when others hurt you. I guess I forgot my S on there. And then learn good ways to control your anger, you or the kid. You tell them, after they're calm, say, let's brainstorm, let's sit here and talk. What are some good things you can do next time? Write those down and put it on the fridge where the kid can see it. And you can say, hey, come back over here. Let's point to this. Hey, look at this. Remember what we said last time? But by doing that, what you're doing is they're getting angry right here. You're saying, come on, let's go to the kitchen and look at this. You're actually walking them away from that anger. You're distracting them, and then they look at that and they're refocusing. Okay? So even though this sounds like this is a simple thing, well, just go look at something on our refrigerator. There's actually a pattern behind it. There's a behavioral response, which is why you're doing it. And you can tell the parents, this is why you're doing it. Don't always tell the kids right away. Then eventually they'll start to figure it out, and they'll be like, oh, that's good. That's a good idea. And you're like, yeah. And then you can get them involved in the therapy. Make choices. Stop and think before you act. There's actually a book called 1, 2, 3 Magic, if any of you guys have ever seen that. I was going to bring my copy, and clinic was crazy, so I forgot. It's a very good book about behavior management for kids, and it's basically, it tells you exactly when to say, the kid's acting up, you say, please don't do that, and they do it anyways. You say, okay, that's 1. You wait for about 15 seconds, you say, okay, that's 2, and then at 3, there's a consequence, okay? And this book is amazing. I love it. If you follow that book specifically, you will change behaviors and really improve behaviors. What I like about it is that it's written not in this medicalese and all that stuff. It's written in such a way that what I'll be like is like, you know what? Go get this and read it. Depending on the age of the kid, read it with your kid so they know exactly what you're doing, okay? And they have tons of examples in there, and what it does is everybody's on the same page. The other book that I really like, which is a real simple one that I can give to parents and stuff, or have them get and stuff, is one called SOS for Parents, okay? And it's Lynn Clark is the guy who does it. And the SOS, you can get it on like Amazon, I think, for like $7 or something. What it does is it talks about why do kids misbehave, what do they do, what are ways that you can manage it. And both of these books are ones that you can adapt the parent's parenting style a little bit to that book. So these are just very good, simple behavior management ones where you don't have to have a ton of training in it. Don't keep the anger inside. Okay, the other thing is use examples. Kids do well with examples. The problem is that now when I talk to adults, like not even at work stuff, I use like way too many like metaphors and examples about things. But one thing that I'll say, my favorite one about the anger is I say, imagine if you have a pot of water, okay, and it's in there and you put a really tight lid on it, okay, and then that's you. You're sitting there. Well, what happens if you turn on the fire? I said, we all have stress in our life, right? If you have a little bit of stress, the water just simmers, it gets a little warm, okay? What happens if we have a lot of stress? Like, let's say something like your parents are getting divorced, you're failing in school, kids are picking on you, all these different things. Well, what happens? That fire keeps going hotter and hotter. Every one of those stresses is another sort of log on that fire. Well, then once it boils and boils and boils, what's going to happen to that lid? It's going to explode, okay? And so what's nice, you tell kids, so instead of using a pot like that, we've got to find out how to make you a teapot, okay, where it's got this little valve where what it'll do is it'll whistle, okay? The steam blows off that way. So you got to find ways to tilt the lid or let the steam off, okay? And what you're doing is you're getting kids to think about it. What are ways that I can do that? So then instead of waiting till their anger goes from 0 to 100, when they're getting about 40, they're saying, wow, I've got to find a way to let this out, okay? Which is why, as we were talking about, she goes running. She rearranges her house. I try to go biking. We all have different things. As adults, we try to learn how to let that out before the anger builds up too much. And then don't sweat the small stuff. Seriously, there's you got to figure out what's appropriate with that for you. I grew up in a house with 7 kids, 5 were adopted, all 3 of my sisters were abused before we adopted them, so we had very interesting dynamics, and I loved it. I had the best family. And if we were playing in the house and something broke, you get so nervous. And my mom's like, you know what? Is everybody okay? Don't do it again. I told you not to play ball in the house. If that ever happens again, you're going to get in trouble. Accidents happen. And so I learned from my mom to not sweat the small stuff. You just say certain things, pick and choose your battles, okay? Because if you get mad at them for leaving a cup out, then if they're a teenager and they come home 5 hours past curfew, and you have the exact same response to leaving a cup out to the exact same response coming 5 hours late, they're not going to understand the level of importance between those two. Okay? Watch the early warning signs. Body language, behavior, or muscle tension. Like if you see people who are always standing like this, I do this a lot, okay? Because for me, it's lots of injuries, sports injuries or stuff that I'd had throughout the years that I will cross my arms like, because I'm like, oh, okay, shoulder pain and stuff. But if you see somebody who sits there like that with a scowl on their face, okay, then that's a different thing. Usually when I'm sitting like this, I'm smiling. So I'm not looking angry, okay? So watch their behavioral stuff. And if they don't want to look at you, other little things like anger is that I had a kid who I was treating whose hair was always to right here. And the way that I knew that we were doing better in therapy, which I wouldn't tell him, but I told the parents, I was like, watch. And as he started doing better, he'd start parting his hair a little bit more. He'd start cutting it until he finally got where his haircut was right here. And he would look out at us. And he had a lot less anger because we could see that he wasn't as angry because the hair started going up. Okay? Little things like that. So look at that. And I've got an example later on about this. And then acknowledge the anger feelings. Say, hey, it's okay to be angry. I'd be mad too if that happened to me. What are you going to do about it? Okay? How are you going to deal with this now? Because sometimes kids think, I can't get angry. I'm not supposed to get angry. And you're like, oh, no, go outside, run around, come back in, then we'll talk. Take a break to cool off, you versus the child. Okay? And this can be if you're in a session with a kid or something and y'all are there and you're working with some kid, and whether it's the parent or the kid and they're just making you angry, hang on, let me go talk to my boss for a second, or hang on, let me go grab a drink of water. I'll be right back. You walk out, you close the door, take a couple deep breaths, walk back in. Stop, think, and act. That's the exact same thing as the 1, 2, 3. Do you know why stop, think, and act is 3 things? 1, 2, 3 is 3 things? Because almost any kid at any developmental level, that's what they can remember. So stop the behavior, deliver a brief scolding, name the behavior. This is key. Make sure they know what you're mad at them for. Okay? Because they may think, pulling up your flowers is not a bad thing because they see you out pulling up weeds every weekend. Okay? You have to teach them. This is the teaching aspect of what we do. Teach the kids. Put them in a timeout if you need to, or calming place. Timeout should never be in a room. And if it is in their room, they should not have TVs. They should not have radio. Timeout needs to be somewhere where they're sitting there and they're just sitting. Let them ponder and think. Don't let them play games to calm down. Okay? Because with all the activities with their fingers and their eyes and their ears, they're lighting up their brain like a Christmas tree when they play video games. So you don't want to do that because that may stimulate them more. Talk to them about the anger or the aggressive behavior. It's okay to be angry when you get in trouble, but let's next time try to prevent getting in trouble. And then follow through with the logical consequence or penalty. And then comment on the good behavior, physical outlets. Anger is the one we see the most, which is why you're going to see the most slides on it. Okay, the others are not as long. Take an interest in your child's activity. Use humor. This works good with teenagers. Because I get these teenagers who will come in and they'll just sit there and I'll say something. And I will get them to laugh at me. If I have kids who are depressed, what I do is I'm always saying something funny, and it's usually about myself. I would never direct it to them or anything else. And then you'll get them to smile. And if I have a kid who's really depressed and I can't get them to smile on the first visit, but on the second or third visit, they're like laughing with me, then that's a sign that they're doing better. I had one kid who was being all stoic and he was all serious. He was like 9. He was kind of this angry kid. And he had a mohawk. And I said, you must have gone the same person I did. I just got the reverse of what you got. And the kid just looked at me and just started laughing. And the resident had come out, and the resident was like, I can't get this kid to talk. And I said that, and then all of a sudden the kid just starts laughing, and I was like, see? I said, you do laugh. I said, I like it. Now that I've seen you laugh, I know you can. So you better not act all serious again like that. And he's fine with that. So you got to find the ways to get in and do stuff like that. It takes 10 seconds, and it works. Okay? Watch what they're doing and figure out how you can relate to them. Change situations. Hopefully you won't need physical restraint. Then there's also bargaining and modeling. So aggression, we're just going to go short with this one. If they're violent, think of their safety first, okay? So when I'm in clinic, the order of it is the child safety, the parent safety, okay, my staff safety, and then my students, and then my residents last, and then I'm the final one. Try not to escalate the situation, okay? You get a kid who's really angry, and you're sitting there thinking, hey, would you like a glass of water? And if you've got a water right there, you've got a soda, hey, let's get this. Calm down. I'm not going to ask you any questions. Just take a little break for a few minutes, and we'll come back in a second. Allow them to cool off if appropriate, okay? Aggression, just be very careful with aggression. Oppositionality. We all see oppositional kids. First thing is find out, why is it happening, okay? If a kid just argues with the parents and the parent says, they're ODD, and you say, well, not really, because you look at the definition. They've got to be oppositional with everybody, with all adults, okay? How do you do with your teachers? Oh, I do great with my teachers. It's just when I get home, I argue with mom and dad or anybody else. Well, that's not ODD. That's a kid who's having oppositional behavior, but not oppositional defiant disorder. Okay, so remember what I said earlier, the definition and the symptoms. Keep them separate sometimes. Sometimes it will overlap like that. Are they negative, hostile, disobedient, and defiant? That's probably an ODD kid. Whereas if a kid's just talking this way with their parents or with somebody else, that tells you something. Treatment, positive reinforcement, give effective commands. Don't be wishy-washy with oppositional kids. It's this way or it's that way. They come in the clinic, if they start acting up and they're starting to be disrespectful and rude to their parents, I will get my... the residents will laugh that I've got my just sort of normal voice, and then when I'm in with patients, I've got my kid voice where I'm saying the exact same thing, but I'm saying it in a softer kind of way. And then I've also got they call it my big boy voice, because it's the same thing they say, like when I'm with adults or oppositional teenagers. I say the exact same that I would, but it's a little more stern sometimes if it needs to be. And I will adapt. And I think all of my kids will know that I care about you a lot, but there are certain things I will not tolerate. I will not tolerate cursing in the office. And now I have kids who come in and they'll say a curse word. I'm so sorry, I didn't mean it. I know you don't like that. And I said, okay, but that's a disrespectful thing. So what do you do when something like that happens? Then they learn to apologize and all that, okay? So you set the rules in your realm. Timeouts and token economies, improve social skills, problem solving. These kids are actually kind of good. If you have a really good group therapist, these kids do great in group therapy, okay? Now, if you get a bunch of oppositional kids, they're going to try to control that entire group therapy. You really need to make sure that you've got somebody who is hopefully two good facilitators. You get two because, one who does process and make sure everybody stays on track, one who does the content of what you're talking about. But you're going to want to have varying levels, not everybody at baseline. You're going to want to have some who are less oppositional who can actually help model for the other kids. These kids do very well with group therapy. All right, so sadness. Sad and lethargic, irritable, defiant. Remember what I said earlier about kids are sad. If you ask a kid who's like 6, are you depressed? They'll say, no, that's what old people get. My mom, I had one kid who said, my mom does that when she sits and eats ice cream on the couch and doesn't move. I said, okay. And so we were talking about it, and I said, well, let me ask you this, because the kid's like, I'm not sad. I said, well, when's the last time you felt happy? And they were like, I don't know if I've ever been happy. This was a 12-year-old. And so I said, okay, well, then we got somewhere to start. That's what we're going to start with. You may not be sad, because remember, it's that language. They may not have all that repertoire of words to use. So they say, okay, well, then let's see what we can do. I mean, this kid was every Siggy cat, the little 9 depressive symptoms, everything was positive except sadness. Okay. He was like, I'm not sad. But then you start talking, and he says, yeah, my friends wonder why I don't laugh ever. Okay, so this is the kind of kid. I said, well, let's get you talking, and let's figure this out. So we got him on an SSRI, put him on antidepressant. We put him on, and then we started the therapy and stuff. And it was like a month later, he's like, is this what it's like to be happy? Like, yeah, it's kind of nice, isn't it? And he's like, I like this, and so you see this response that you get from the kids. Give them a chance to talk about how they feel. Don't always interrupt. Just say, tell me, what is it? How do you feel? Draw it, describe it, whatever. Because they're going to try to sometimes put it in words that we understand. That doesn't matter. You want to put it in words that they understand, and we'll adapt to that. You'll get a kid sometimes who will take a black crayon, make a big black hole. That's how I feel. Okay? Then you're like, all right, well, got some work got to do, But you figure out, where is it? I'm a huge believer in drawing too. If you guys could only have one thing in your office, it's like crayons and paper. That's it, white paper. You learn so much from that. Determine if it's temporary or more long-lasting. Okay, and that's a very important thing. If a kid's being teased at school, fix the teasing, and that may be temporary and make it better. If parents are getting divorced, that could be very long-lasting unless the parents do well. The way that a kid does after a divorce is how the parents do. The way that a kid does after a parent has died, how the surviving parent does. Okay? So you really can't just focus on the kid. You ought to really focus on the parent too. Family history. If there's a long, long history of sadness, then it's going to be a lot harder to get this kid better, because if everybody in the household is depressed, then they're not going to see kind of what's out there. Allow them to talk to peers. This is something that's huge. They used to do this at one of the school districts down on the south side, but they don't do it anymore, I don't think. They actually had a peer support suicide group, okay? And what happened is that they would take a kid who's been through certain feelings, who's felt suicidal, who's felt depressed, and they would take that kid and they would sort of train them a little bit to talk to other kids. Kids talk to each other, but they don't talk to us. And the last thing, and this is huge, are they suicidal? Okay, because that's the big thing. You want to make sure that if they are, we've got to get that taken care of. And you know, if you don't know how to manage that, you call somebody that can. Okay, so like here, for example, if you're going to call here, if sometimes I'll get a phone call from like a pediatrician. They'll say, I think that this kid's suicidal, but I'm not sure. I don't know if they're really going to do it or not. Then they say, what should I do? I said, well, then you need somebody who is a professional in that to assess it. Just like you're not going to come to me and say, hey, I've got a throat infection, will you give me an antibiotic? Because I'm like, I have to look that up, and I don't know that. But my wife can tell you off the top of her head, okay? Of course, she wants to convert all of y'all to kilograms instead of pounds, but that's what pediatricians do. And so you go and send them somewhere where they can do that. If you can get them in with a clinic right away, that's fine. Like here, we have, anytime a kid comes in for an assessment, it's done by a psychiatrist, okay? Whether it's one of my fellows, whether it's one of the attendings here. And so then if we say, you don't need to be admitted, you at least know, wow, that kid's been seen by a psychiatrist, and they're somebody who does this for a living has seen them. I think that's a very helpful thing to know, that when in doubt, there's always backups, okay? You know, you can always call places and say, what do we do? What do we need to, you know, what kind of help is out there? Mania. Basically, the main point of this, if you guys see a kid that you really think is manic, send them to the hospital. Okay? If you're seeing a psychiatrist, call the psychiatrist. Okay? You don't want to be dealing with the manic kid. The thing about mania that's important is that if it's causing an impairment in their functioning, then it's bad. Okay? Meaning they're not able to work at school, they're not able to have social interactions or whatever. Somebody who is hypomanic, if you imagine an adult who's hypomanic, they're somebody who is still functional, they're just kind of annoying at times because they're like, leave me alone, I'm trying to do some work, and they keep coming in and bothering you or something. That's the hypomania. They're still functioning, they're just kind of bothering you. Other times, if kids get manic, actually only about 45% of kids who have mania have decreased need for sleep. You know, we think of adults, you think, oh, they don't need sleep. Kids, they'll still sleep. They'll be cycling up and down, okay? But if in doubt, you call somebody. They will get hypersexual. They will get grandiose, thinking that they can fly, or they're bulletproof. I had a lot of kids that I've seen who've jumped off the roof and broken an arm. They thought they could fly. Well, they were manic, okay? Or I have other kids who jump off because somebody dared them, which is different. It's impulsive, okay? So you got to figure out kind of where it's coming from and what it is. So figure out how to, if in doubt, send them somewhere, get them treated. You know, let us sort of sort it out.